People of Tioga County should take this disease seriously. Over time, it does cause people to lose vision, lose toes, legs, loss of sensation in their fingers and their toes if they keep them. It's a devastating disease that over time it can take you out. Hi, I'm Bob Strohecker from Strohecker Vision Care in Mansfield, Pennsylvania. Today I'd like to talk to you about diabetes, which is an epidemic. Currently about 10% of the U.S. population has diabetes. Many of them don't even realize that they do. In my own patient base, 20 to 25% of the patients I see on a daily basis are patients with diabetes. The cost of diabetic-related care in the United States is enormous. Currently about $322 billion a year, $1,000 for every man, woman, and child living in this nation. We don't really know what causes diabetes. Type 1, we believe it's probably viral or something that destroys the cells in the pancreas that actually produce insulin. Insulin is a hormone that helps your body absorb sugars from the blood. Diabetics are missing this because the pancreas is not working properly any longer. As we age, the second type of diabetes is called type 2 diabetes. And type 2 diabetes results typically from obesity, poor food choices, lack of exercise, and this occurs when the receptors that receive insulin become saturated or kind of desensitized and become less efficient. And when this happens, the body does not absorb the insulin necessary to process sugars within the blood. In the eye, what happens is you have a breakdown of the smallest vasculature in the body. Because of this breakdown, you have leakage of blood and other protein and serous or liquid materials from the bloodstream into the surrounding tissues of the retina. This can occur with swelling of the central retina. This also releases factors that cause new blood vessel growth, which can cause some, we call it neovascularization into the gel of the eye. If neovascularization occurs, then you're at risk for developing a detachment of the retina. It's imperative that you come in for an annual dilated retinal exam. You have to understand that it's truly the only place in the body that we can actually look at vessels and see how they're being affected by this disease, because we can visualize it. And the other place, you'd have to dissect the tissue. So it's a really easy way to get an assessment of the systemic health of any diabetic patient. One of the unique instruments that we have here is called the OptiMap, which gives us a panoramic or a wide field view of the retina, and we can even get this picture undilated most of the time. This is, I think, one of the best, probably the best way of monitoring the retina for early diabetic changes. My take home from all of this is, if you are a diabetic or have been diagnosed with diabetes, follow up with your family practice doctor on a regular basis and take this disease very seriously. Also, from an eye standpoint, come in annually for at least a dilated retinal examination, and even better, the OptiMap screening of the panoramic screening of the retina in the back of the eye. And don't forget, do your part as well. Exercise, lose weight, eat proper food groups, and cut back on sugar intake. Like any disease process, it's easier to prevent in the long term than treat once it's been diagnosed. So if you know that you have diabetes, or suspect that you may have diabetes, or have a family history of diabetes, and it's been more than a year since your last examination, give our office a call. Our goal is to help you prevent vision loss as the result of this disease.